Hey everybody, and welcome to the first episode of Let's Talk Resilience, the one-stop podcast by international youth from all around the world, actually from 9 different countries, as a part of the Global Youth Summit. This podcast is being hosted by Group One, where we talk about building resilience in the post-COVID-19 era. I'm your co-host, Melissa Reismüller from Germany, and I study management and technology at the university in Munich.
Hi everyone, I'm Hyung Lim from Korea and I study biology in Hangul University of Foreign Studies.
Yes, exactly. So Hyung and I will now talk about the first topic that we talked about in our group in the Global Youth Summit, which is the topic of health and healthcare during the COVID-19 era, and even more important, the post-COVID-19 era currently. So let's start by actually defining what resilience is, because I think it's a bit of a tricky, definition for some of us. I remember when I started out with the Global Youth Summit, I was not really sure if I understood what it is. Like resilience, a very, fancy word. But
Yeah.
I think, I don't know. I mean, I think it is about overcoming and getting stronger from a crisis, you know?
Mm.
What do you think, Hyung? What would you say is resilience in one sentence?
I think resilience is the way to get positive ways to all around the world.
Definitely. Yeah, definitely. It's a very global issue and like topic. And
Mhm.
even if like we looked at different parts of resilience, which you will later see in the other podcast episodes, we're now starting with health and healthcare. Now, Hyung, why did you choose health as your main topic during the Global Youth Summit in Korea?
I think mostly my major is biology and COVID-19 is really an issue of people's health. And I think that's the major problem for COVID-19. And the, the main issue we are really have to figure out for a post-COVID era.
Yeah,
What's your motivation, Melissa?
I mean, for me, I'm doing a minor in medicine, so I was very interested in the medicine part. And I also
Yeah.
think that, I mean, we're all aware that, Corona, COVID-19 was a very, very heavy impact on the healthcare systems around the world. And
Yeah.
I also think that we have to focus now in this post-COVID-19 era, in this post-crisis era, also on healthcare, because with all of those different problems going on with inflation and economic problems and social problems, yeah, I think we still are struggling with health and healthcare, and I
Me
really wanted
too.
to discuss it with people on an international level, and I was so happy to actually do it with you guys.
Yeah, me too.
Um, so actually, for you listeners out there, during the Global Youth Summit, which was the first Global Youth Summit in Korea, we
Yes.
actually discussed health in a global context, and then we had to do a recommendation for the Ministry of Gender Equality and Family in Korea. And
Yes.
yeah, let's just try to tell the audience what we actually came up with, what are problems and maybe also solutions of this health problem and issue on a global level. Um, so what did we have? Maybe let's start with mental health that we mentioned.
Including mental health checkups as a regular procedure, along with prescribed physical checkups in normalization healthcare systems.
True. Yeah. So I think what we mentioned throughout the discussion groups and, just the whole summit was that mental health has been a problem during the COVID-19 crisis and still is a problem in this post-19 crisis.
Yeah,
So,
true.
yeah, I don't know. Maybe you can tell us a bit about the mental health situation in Korea. Do you see a lot of problems, or did you see a lot of problems in COVID-19 crisis and now also after?
I think through the COVID-19 pandemic, a lot of people has to stay home, right? And that made people are more like depressed
Yeah,
and yeah, really depressed and really want to go out and that's not working. So a lot of like government systems are coming out to care about people's mental health, like including healthcare system and mental care systems are really in a process even till today. So like mental is really important in health. So government is really putting a lot of force to it.
yeah. Yeah, no, I also during the Global Youth Summit, we also visited the Yocho Youth Center, right? And there we had like,
Actually,
oh,
yeah.
such a thank
Yeah.
you, such a youth center. Good thing we have a Korean person here who knows how to pronounce things correctly. And this, what I found very interesting, they had in this youth center, so it was like a community center for, like teenagers and children that just could go there and have do some activities. And you had a whole floor only for mental health. Like it was very pretty with flowers and it was scented. You even had machines that like measure brain waves. It was
Yes.
crazy. The whole technology was very advanced and
Oh, thank you.
it was crazy, yeah. I mean, the thing is also because we had also participants going from Europe into Southeast Asia. So we have participants in our group from Egypt, Tunisia, Singapore, Uzbekistan. And while doing research throughout the summit, we found that on a global level, we have depression rates and anxiety rates that are even higher, that have been even higher during the crisis, but have not gone to normal levels now after the crisis. And as a in our proposal, we also put that we need more distribution on the professional side because we have a lot of, um, places where you don't have actually access to mental health professionals. On the other hand, you have places with, abundant resources. So we also even thought about doing a metaverse solution where during like with the metaverse, we would try to connect health professionals and mental health professionals with the people in need on a global level, which is also very important because the metaverse can also include this non-verbal cues and, for example, psychotherapy, which is very important for the treatment and the therapy itself. But what else did we talk about, Hyung, in the recommendation apart from mental health?
We talked about oh, sorry.
No problem.
Elementating elementating disportation.
Yeah, we also already did that. Go down to telemedicine or care, whatever you want to talk about.
Sorry, my tongue. Employing recent developments in telemedicine to streamline medical processes and integrating clinical decision support.
Yeah, exactly. Do you see in Korea a lot of like telemedicine and like digital medical, I don't know, like support?
Think talking about the Sotro Youth Center, there's a lot of like machine to care about people. And I think the machine that I saw is about the mental health, I guess.
Yeah,
Yeah, because like in physical health, people are going to the doctors, not to the machines, right?
yeah. I mean, it is a problem that you don't have much trust currently, also with
Mhm.
older generations, when you want
Yeah.
to implement, digital health. I think for Germany, I mean, you also have now the option of doing, the first, how do you say this? Like the first doctor's appointment where they just go through some questions. You can do that online and can also, do an online meeting just so they can see what your problem is. But I also have a lot of people who don't trust it and actually want to go to the doctors, even though it's very hard to get a place here. Like you really have to wait months until you get an appointment.
No.
Yeah, but I think it's important also if you support the telemedicine more, then it gets, easily or fast integrated into the society. And maybe if like everyone starts to do it, then also the older generation will start to, um, feel like it's, I don't know, like a trustable source of information in regards to health. But what I've also seen in Germany is that we're trying to digitalize actually um, in the hospital a lot of processes. So we're trying to digitalize a lot of like, for example, the probes, like the
Yeah.
blood probes or something, so that they don't get lost. We have
Hmm.
new ideas and startups that are trying to do it with QR codes so that the information is transferred more easily to the, health professional. And there's a lot of like AI recognition for MRI pictures or, just in general in the hospital processes, which I think is very nice, very important, and which should definitely be supported further on in the future, right?
Um, because COVID-19 made people stay in home, so um, like through the internet and digital are really important to like important method through it.
Definitely, yeah.
Mm.
And I mean, the last thing, which is I think also very important, which we all saw on a global level, is how weak actually our healthcare systems were, just in general for physical health, and how, how no country was prepared for such a big pandemic, and there
Sure.
were hospital spaces. And I think because I would say Germany and Korea are more on the developed side of the countries, we can just imagine how bad it was for the developing countries. And I mean, a lot of our teammates also talked about it, those from Egypt or Tunisia or Pakistan. And I think it's definitely important to also harmonize a lot on a global level,
Yeah.
depending on how possible it is. So, yeah, I mean, that were most of our recommendations. I mean, the most important one is actually raising the awareness of the issues by, for example, doing a podcast about it. And actually, just wanting to start a dialogue or, just a discussion with all of you guys around the world that are listening about what parts of healthcare really need to be improved in on a global level and need to be harmonized on a global level so we all can have, active participation in creating a more sustainable and better future, which was also like the main topic of the Global Youth Summit, which we participated in. Um, so yes, I think that's all for today. I thank you listeners so much for joining us on this journey towards a more resilient future. And I hope you guys all stay tuned for our next episode, where two other fantastic hosts from our group one will talk about other issues that we discussed in our Global Youth Summit. So, yeah, thank you guys for listening and see you then.